Welcome to our 5 on 5. We're pleased to welcome Dr. Shawn Sills from Touchstone Pain Management. He's an anesthesiologist specializing in pain management and addiction medicine. Shawn, thank you for being here. How are you doing?
Good. Thanks, Craig.
Very good. So we hear a lot from local police and Jackson County Health Department even about heroin and opiate abuse in the Rogue Valley skyrocketing. Is that what you're seeing?
Yeah, that's exactly what I'm seeing in my practice. Over the last 8 to 10 years, we've seen like a real surge of people that are abusing opiate medications like methadone, oxycodone, heroin, seeing a surge in accidental overdoses. And Jackson, Josephine County is probably the worst offenders in our state.
Wow. Don't like hearing that.
It's pretty epidemic. It's pretty sad.
Yeah, and so how are you helping, using your past experience with addiction to help patients? How do we get through in changing this pattern?
Yeah, about 7 years ago, I went through a difficult time personally and professionally and developed addiction and a substance use disorder and went to treatment and went to a facility that specialized in treating physicians. And fortunately, I found recovery. And after that experience, initially in my recovery, I was like regretting the past and felt bad about things. But what I found is as much as I wanted to regret the past, I couldn't change the past. Mm-hmm. But I could use those experiences to try to help other people. And so 4 years ago, I got board certified in addiction medicine and then opened up an addiction medicine practice 3 years ago. What I do is use Suboxone, which is another medication that we use to taper patients off of so they can get off of opiates.
Okay, so no cold turkey quitting. It's a medical thing. It's in their body, correct? They need that physical fix, for lack of a better term?
Yeah, Suboxone is a unique medication. It typically has less severe withdrawals than other opiates. So if we start a patient on Suboxone, we can typically taper it over several weeks, several months. And while we're doing that, we work on building the recovery program. So we'll have them see a counselor for individual group therapy. They'll go to 12-step meetings. We'll do random urine drug screens. All the while, we're tapering their dose of Suboxone until they get abstinent. So the goal of our program is for complete abstinence.
Wow, very interesting. All right, we're going to take a quick break. We'll have much more with Dr. Sills in a moment. Stay with us. Welcome back to our 5 on 5. Again, we're here with Dr. Shawn Sills from Touchstone Pain Management. Dr. Sills, tell us, you're working with the Addictions Recovery Center. What is your involvement with that organization? Yeah,
recently I just got asked by the Addiction Recovery Center to be the medical director for a new medically monitored detox facility. So some substances are very difficult to get off. The withdrawals are very severe, and sometimes withdrawals can be fatal. And so there is no facility in the Rogue Valley to medically safely detox patients. You have to go up to up to Eugene or up to Portland. So what we're providing, hopefully this September, will be an 8-bed facility where under medical supervision, we can use medications to safely and humanely help patients wean off their opiates or alcohol or benzodiazepines.
Sure. Okay. So, how are medical advancements helping you in treating these people or people with pain?
Yeah. So what I practice is interventional pain management. And what that is using minimally invasive techniques to treat pain without the use of opiate medication or traditional pain medicine. We'll use techniques where we target pain generators in the spine, either to introduce medication to reduce inflammation, or actually I'll perform procedures to silence nerves that are carrying painful information to the brain. That's called radiofrequency ablation. The other techniques we use are spinal cord stimulation, where we put electrodes behind the spinal cord to try to block out pain. And all those are ongoing, evolving, getting better, and we're able to offer patients a lot more effective ways of treating their pain than.
Wow, that's pretty cool. Yeah. Very, very amazing technology and how it advances. All right, so if people want to find out more information, touchstonepain.com, correct?
Yes, touchstonepain.com.
Very good. Okay. Dr. Sills, great to see you. Thanks so much for being here. Appreciate it.
Appreciate it.
All right, stay with us. We'll be right back.